Hi, welcome back. I'm Adam Rosen. In today's day and age, a lot of people play tennis and golf, and even more people are playing pickleball on a regular basis. And this has unfortunately led to a number of people developing elbow pain and what has been commonly called either tennis elbow or golfer's elbow. And in today's video, I'm going to talk to you about what each of those are and how you can start treating it at home. Hi, thanks for tuning in again. And if you haven't already, please subscribe and click the like button so people like you can find information like this. I see a number of people in the office that have complaints of elbow pain, and you can have pain on either the outside or the inside of the elbow. My patients that present with pain on the outside, or what we call the lateral aspect of the elbow, commonly are diagnosed with tendinitis, which has been termed tennis elbow. It's where the extensor tendons insert to the humerus, or the upper bone of the arm. Now on the inside of your elbow, or what we call the medial aspect of the elbow, the flexor tendons attach there. And that has been commonly referred to as golfer's elbow. So what causes this inflammation or this pain? Well, typically it's how you grab the racket or grab the golf club. We also see this in people that are carpenters, so by taking the hammer and repetitively hitting things, even in people that are frequent travelers, how they carry their luggage, and young parents who are carrying their baby around in the car seat constantly develop inflammation of those tendons, and sometimes knowing what the actual cause of the inflammation or pain was helps us develop a treatment plan that is going to help get rid of these symptoms that you're dealing with. So how we diagnose this is quite simple. Once we rule out other things, such as nerve entrapment injuries or ligament injuries, it's a matter of finding the area where the tendon inserts pushing, and that can cause exquisite pain. Or we might actually have you, for tennis elbow, have the wrist down like this and try to extend. And as you extend, if we're pushing, it's going to cause pain. And the same holds true on the inside aspect of your elbow. So if the inside aspect of your elbow is sore, we're going to have you try to flex the wrist against our resistance, and it's going to reproduce the pain that you're getting after you play these activities or while you're doing these activities, and that pain comes on from the inflammation where that tendon inserts to the bone. Okay, so now that you've been diagnosed with either tennis elbow or golfer's elbow, what can you do to treat this? Well, the first thing, and the thing that people hate to hear, is stop doing the thing that caused it in the first place. So you may need to take a break from the sport that you enjoy, but that's going to allow this inflammation to subside and the tendon to potentially heal. The next things are things that you can do at home. These are things that are quite simple, things like ice. Some people even like the idea of contrast, using ice followed by heat, followed by ice again. The other thing which can help are just simply massaging the area, and you can kind of use your fingers to massage the area, or you can buy these over-the-counter bands, which will actually grab the elbow below where the tendon's inflamed and try to transition where the load is taken up by that muscle tendon unit. So there are a few simple things that you can do. The other things that you can do are some home stretching exercises. So you can do one exercise where you stretch the extensor tendons. This is where you keep the elbow fairly straight, and you take the wrist and you flex it down. And with your other hand, you pull a little bit more, and you'll feel that tension on the outside part of your elbow. This is most important for people that have tennis elbow or lateral epicondylitis, but it's good to do both of these exercises because the other exercise is predominantly for people with golfer's elbow or medial epicondylitis. So again, the elbow is straight, but you're going to extend the wrist, and with your other hand, pull back even further, and you're going to feel some pulling and stretching on that inside part of your elbow where the tendon attaches to that bump on the inside part of your elbow. Now, there are some other things that you can do if you play racket sports. So if you play golf or pickleball or tennis, what you can actually do is work with somebody, or you can buy things over the counter at the sports store to increase the diameter of your grip. So if the grip you're squeezing is quite tight, sometimes by adding a different grip, which opens up your hand, can change the forces on the tendon and prevent this from reoccurring once you go back to the sport or activity that you enjoy doing. Now, there's a few other things that we can do as physicians. So sometimes if the home exercises haven't been helpful, we might give you a prescription for formal physical therapy, and they can do additional stretching, strengthening, and use other modalities which may help reduce the inflammation. Occasionally, you'll be offered an injection. So if those first things that we talked about don't help, a cortisone injection can sometimes be helpful. And even the use of what's called PRP, or platelet-rich plasma, may be helpful. Still up in the air. There are some studies that show for this golfer's elbow, tennis elbow, it is helpful, and other studies have shown that it's not as helpful. But it's an option if those other things have failed. Because the option of last resort is surgery. So if all of those things have failed and you've had chronic problems, your surgeon might talk to you about the surgical options and go over what's involved with it, what the recovery and expectations would be. So one last thing I want to definitely be sure to share with you is the use of anti-inflammatories. So if you don't have a contraindication to using these medications, you may get a prescription from your doctor or use an over-the-counter anti-inflammatory, either in pill form or what a lot of patients that have had tennis elbow or golfer's elbow have found helpful are some of the over-the-counter topical creams that you can rub on the area of inflammation. This might also help reduce the pain. If you need more of these exercises that I showed you, I'm going to put a link in the show notes to those exercises, because beyond those first two stretches, once the pain is improved, there are a series of strengthening exercises that you can do at home, either with a small weight or even a soup can, to increase the strength of those muscles that have been diseased or damaged. And I'll also put a link to an over-the-counter band that you can try if those symptoms have been bothering you. But if you're someone that's been dealing with these problems, be sure to get it checked out, just to make sure that there's not a ligament problem or a nerve entrapment issue, because the most important thing for us and for you is to get rid of the pain and get you back to doing the things that you love. So until next time, I'm Adam Rosen. Thanks for watching. Stay safe.